I am Senior Lecturer in Medical Education. I've worked at Lancaster University for about 5 years now, and my main role in the undergraduate MBCHB is on our SSM, Special Study Module Programme. Now, often I come and I talk about SSMs to clinicians who are interested in getting involved, but this year I thought I'd do something a bit different and try and talk to you a little bit about all of the opportunities that we have at Lancaster to get involved in different aspects of the curriculum. And what I'm really hoping is that it will give you a little bit of inspiration about where you might be able to fit some form of medical education into your work. I mean, I don't think I need to tell you that it's been a difficult year for us all, and I know that everyone is feeling the pressure around, taking extra stuff on. But at the same time, training our future generation of medical students has never really, it's never felt as important. This is a crucial moment in making sure that we keep going with getting students up to the standard that we need so that the NHS can continue to survive and to thrive. So what I'm going to talk to you about today, I'm going to talk through several different opportunities that there are within the curriculum to get involved. Talk to you a little bit about what that means, what we require, what's involved in terms of responsibility and time commitment, and try and give you an idea of why you might want to do that and the benefits of getting involved. It's going to be a bit of a whistle-stop tour, but I'm going to try and cover the kind of highlights of some of the opportunities to get involved in the curriculum and some of the important information you need, and also to make sure that you have next steps, really. So if you think, actually, yes, that's something that I'd love to do, I'd really like to get involved in that aspect, what do I do next? So that's the kind of crucial bit, I guess. I wanted to flag at this point, if you do get in touch and fill in any of our kind of surveys or forms or what have you, and you're expressing an interest in getting involved, what that means is that we add you to one of our databases. So it's not that we're going to email you 17 times a week and try and get you involved whenever we can, but it's just to let you know that if you get in touch with, in response to me talking about any of these opportunities, then we'll kind of keep your name on record, and when another opportunity to get involved comes up, we'll drop you an email and say, is this a good time for you? So there are going to be, I guess, 4 or 5 main things that I'm going to talk about, just in terms of the kind of starting point, our admissions interviews, ways to get involved in writing exam questions, student projects at various levels, and OSCE examining. And what I really wanted to kind of talk about a little bit is the kind of nitty-gritty of it. So how much time does it take? What skills do you need? What training is available to help you? Why would you want to do it? Who can do it? And then if you think, actually, yes, this is for me, how do you get involved? But before I do that, I wanted to just give you a little bit of an outline, very briefly, about Lancaster Medical School, because I thought to myself when I was writing this presentation, it might be that you're not very familiar with how we teach, what we do, and how the curriculum is delivered. So, Lancaster Medical School, we were founded in around 2006 is the kind of formal date that we started putting things in place to deliver medical education in this part of the world. We were initially a school that was under the Liverpool University Medical School curriculum, and as time progressed, we went on and got our ability to award our own primary medical qualification. So we revised the whole curriculum, and that was awarded eventually in 2017. It's quite a lengthy and involved process getting approval from the GMC, and so it really filled me with confidence when I started at Lancaster that we were kind of nearly at the end of that process, and it was so good to see all of the quality standards and the work that we'd put in to ensuring good medical education for the students. We have a problem-based learning curriculum, quite different to a traditional learning lecture-based curriculum. The students have a lot of self-directed study. Yes, there are lectures and we recommend resources and things to help support their learning, but fundamentally it's about getting them to think from an early stage about problem solving and making sure that the knowledge that they have about different conditions and elements of medicine can be applied in practice. Obviously, they also have training in anatomy, clinical skills, communication skills, everything that you would expect. And we also pride ourselves on having early clinical experience for the students. So from year 2, in a normal year, they are out 2 days a week in practice, either in hospital or in GP. Another thing that I'm really proud of about working at Lancaster is that we are passionate and skilled at widening participation in medicine. So many of our students come from non-traditional backgrounds, and I really believe that, trying to ensure diversity in the workforce and that the future doctors represent the communities that they are going to be looking after is really, really crucial. We work with a number of trusts across the Northwest, so yourselves in Blackpool are big contributors to the work that we do. We also work with Morecambe Bay and with East Lancs Teaching Hospitals, so students are kind of all over the place, and I think that's really good for them because they get experiences from different hospitals, different systems, different ways of doing things. So that was all I was going to say, just as a bit of an overview of the medical school, but I'm happy to take questions at the end if there's anything that's not quite clear. I'm going to go on and talk first about the first opportunity to get involved in medical education, and that's with our admissions interviews. I thought I'd start with them because they're the first thing that happens if potential students are looking into coming to Lancaster. The first thing that happens is they go through the admissions process. So at Lancaster, we run a system called multiple mini interviews. It may be something that you're quite familiar with, but I just wanted to give you a brief overview of the whole process, just in case it's something that you've not come across before. Now, at Lancaster, we have a 5-year undergraduate medical degree, and we have 125 places on that degree, plus 4 international student places every year. We used to have fewer places, so in our upper years, we still have either 54 or 70 students. There was a kind of drive around 2017 to increase medical student places and student numbers. So now we have 125 places that feed into the foundation programme. We also run a 6-year programme, so we call it Medicine and Surgery with a Gateway Year. So it's helping students who maybe haven't taken the right A-levels or haven't had the same access to some of the resources that other students have had to get into medicine, to give them that grounding before they start on the 5-year MBCHB. Now, what that means fundamentally is that we interview around 500 potential students a year. It's a big process, it's a big commitment for us, but it's really important to ensure that we get the right students for the course and a good quality of students. So what the whole process looks like, the admissions process, is obviously we start out with the students' academic grades. So these are reviewed according to various quality standards. I'm not going to go into detail about this because it's not the focus of what you would be involved in, but just to kind of give you an overview of the process. Academic standards is where we start. We also use the BMAT, the Biomedical Admissions Test, for students to ensure that they're meeting some of those key areas of knowledge that we want to make sure they have. Then the interview. I'll talk more about that in a moment in terms of the format of it. And finally, they go through a fitness practice process to make sure that they are going to be the kinds of students that we're looking for, who are going to go forward and thrive in medicine. So the multiple mini interview format, it's quite short and sharp in a lot of ways. It's quite similar to an OSCE. So like an OSCE, a student will go around and do several different tasks, with different interviewers throughout the process. The stations are 5 minutes long, and how we run it is a kind of day process where the students would be around on a circuit, like an OSCE, for a morning. And there are several cycles in a day. So, when you get involved, it's quite a short time commitment in a lot of ways. So if you're looking for something that kind of starts you out and gets you involved, MMI is a really good place to start. Normally you have 11 or 12 applicants per cycle of MMI, and you do a couple of those in the day. It can be quite intense in some ways, but I actually find it really enjoyable because you're kind of getting to see a flavour of the potential students that we're looking to work with. And the thing that's fantastic about them is that the admissions team are super organised, they're super helpful, and there are so many really clear instructions on how you do everything in the different stations. I find it interesting because it's this format, this MMI format, is very different from your traditional interviews that you might have. But the thing about it is, it's really reliable. So if a student messes up a station, if they have a moment where they can't demonstrate those skills, if it was a traditional interview with a panel of people, that would be their one chance, and they, wouldn't have been given the opportunity to shine and show their best. But in this format, they can go through, they can have a bad station, they can excel, they can show off their skills at different points. I thought I'd just give you a quick look at what that really looks like in practice. So there are multiple assessors, as I say. If you got involved in the MMIs, you would be assigned to a particular station, and that station would come with full instructions as to what you did and how you scored. The clearly defined criteria that we have around scoring really help to make it less subjective. So, you're put in a position where you're well supported to try and get the best out of the students and to make sure that you're being fair to them. But in a typical MMI, we have a group workstation, which looks at helping the students to understand whether problem-based learning, the format that we do, is right for them. We have stations on data, on ethics. We have a student-led station. I mean, these stations vary every year in exactly what they include, but we're trying to test certain key skills. So, can they give instructions? Can they demonstrate good communication skills? Can they talk to us about what they've done in their career before? And can they demonstrate certain skills? So what does that mean for you? Well, time commitment, as I've said, you can do as many or as few MMIs as you like, but it can be helpful for you to kind of get into the rhythm of it, to do maybe 3 or 4 days in a year. And the sessions all occur in January, February. So that's the kind of commitment that you would be making. The training is provided on the day, so there's nothing to do in advance. And if you've done MMIs before, there's an annual refresher that you can just take as well to make sure that you're up to speed on what is happening. In terms of the benefits, it's really, really nice to have a say in who the students might be. These are people that you might end up teaching, you might end up working alongside in the future. And so having the opportunity to say, yes, this is the kind of person I think should go forward and be involved in having the opportunity to try and progress through medical education, I think is really great. It's a very broad church where you take anyone from FY2 level and above to get involved. So if you're more junior and you're kind of training at the moment and it's something that you think you might want to get involved with, this is a good starting point. And I've put the email address that you need to contact if you want to get involved in the MMIs there. Now, I'm giving this presentation in April. Our MMI circuit for this year is closed, but I'd say if it's something that you're interested in, if you put your name down, then when we're sorting things out in kind of October, November, December time, that's when the admissions office will get in touch with you and talk to you a little bit about, what commitment you might be able to make. So you don't have to sign up for anything in particular, but it's good to get your name on the list if you think it's something you're interested in. Now, I'm going to move on now and talk about examination question writing. And again, I've started out with the things that are, I guess, easier to get involved with and to fit in with some of the other commitments that you might already have. So if you think, yes, I'd like to start getting involved in medical education, but I don't really have a lot of time, this is another one that's really good to start with. So just to give you a bit of an overview. In a normal year, this is what our assessment map looks like. I'll talk about the OSCEs separately, but fundamentally we have exams across the 4 years, and we have within Lancaster Medical School, perhaps I should have said this earlier, we have what we call 4 curricular themes. So within the problem-based learning that we offer, we mainly cover the medical sciences, as you might expect, and this forms the bulk of our assessment. However, we also have 3 other themes. We call them population health. So this is stuff around data and public health and ensuring that the students kind of understand statistics. We have health, culture and society. So this is sociology and psychology, and professional practice values and ethics. So medical law, medical ethics, all of that kind of stuff gets put into that little bracket. And you can see from this that we have a lot of examinations, perhaps. I think the students would definitely agree that there are a lot of exams, but we try and ensure that we're kind of covering all of the different content that we look at over the course. So you can see that in it pretty much every year, normally the students have kind of 240 marks worth of assessment on medical sciences and 90 marks on the other 3 themes. It looks a little bit different in year 3, but I won't go into that because I don't really think it's going to be very, very helpful. So how do we examine? We mainly use, for medical sciences and population health, a format that you may have come across called the single best answer. It's kind of like a multiple choice question, but it's not, because it has to meet certain criteria for it to be a single best answer question. Okay, so it has to have a scenario before it. You have to use the scenario to be able to answer the question. Okay, so it's about the application of knowledge rather than kind of just picking from a list. And so each SBA has 3 components: a short scenario, can literally be 1 or 2 lines, a lead-in, which is the question, and then 5 possible answers. And the idea of the single best answer is that the other 4 options, even though they are not correct, they're not the best answer, they're plausible. Okay, so rather than a multiple choice question where you might have what we call distractors that are not necessarily realistic or relevant, in an SBA, it has to look like it could potentially be any of the answers. Now, we use these SBAs as what we call a single point assessment. So it happens in an exam, it's a one-off, it's something that the student has to kind of engage with and pass. It's part of the whole process. So, you know, we also have short answer questions, we have coursework, we have OSCEs that form part of the way in which we try and assess at different points whether or not the students are meeting the standard we would expect for a medical student at that stage. We also have continuous assessment via our portfolio program. So the students will have a portfolio in Kaizen where they record their kind of clinical skills and other experiences and evidencing of skills that we ask them for. And single best answers, we use them because they're very helpful in terms of making sure that the students have a breadth of knowledge, also ensures that they have a bit of a depth of knowledge, that they have the skills that we're looking for. So problem solving, you know, can you take this scenario and then tell me what the solution to this would be, and that they can apply the knowledge that we're telling them. So it's really trying to get the students away from what we'd call rote learning, where you would just be able to recite a list of 10 conditions or 10 symptoms about a disease, and that would be all they would know. It's about, you know, can you reason, can you rationalize, can you use your skills to show that you can apply this in practice. Now, I didn't want to talk in too much detail about the exam process, because I think that the things I want to get across to you are that we have these amazing quality assurance processes. Sometimes I think when people are starting out with the idea of writing exam questions, it can seem quite daunting. But actually, we support you very well to try and make sure that the questions that you're writing are appropriate, they're at the right level, they relate to the curriculum, and that they are, you know, they have the right answers, all of that kind of stuff. And so this slide just briefly outlines our quality assurance processes. It's a multiple stage thing, and I think it's really important to kind of be aware of this, because it's not just like you write a question and then that goes into the exam. There's a lot that goes on around that. So how do you get involved? As I think I tried to say at the start of this little section, you can give as much or as little time to writing exam questions as you like. You could write 1 on your particular area of expertise or your specialist subject. You could write a whole bunch of them for our bank that we would then use across the different years and at different points in different assessments. We have regular supported writing sessions. So if it was something you thought you might want to get involved in, sign up, and then we can partner you up with somebody who has more experience, and you can learn a little bit from them about how best to write a question and to try and improve your skills in it. I think that's really nice, because that element of peer support I think is very helpful when you're starting something new. For every 10 questions that you write, you get a certificate of achievement. And again, this is something that people can get involved in from quite early in their medical training. So again, I've put the email address on the screen. I've also collated these email addresses at the end of the presentation, so you've got a full list of how to get involved if you want to. Now, I'm going to talk now about special study modules, which are my area of expertise, my specialty. We call them SSMs as well. And at the moment, what I would mainly be asking you to do would be to get involved with our SSM programme in Year 2. So SSMs are basically an assessed project that you would complete with the student. You would have between 1 and 4 students with you for 4 weeks, not constantly. I'll talk more about that in a second, but that would be the kind of time commitment that you would spend with a student. So it's a little bit more involved than some of the things I've spoken about before, but still something that fits around or is designed to fit around your general work. We talk about SSM conveners, so an academic or a clinician can convene an SSM. And what that really means is that you will design a project that the student will undertake, and the students will select those projects from a catalogue. The SSMs, the 4 weeks themselves, are delivered in November, December annually, but we start to collect projects throughout the year, anytime from now onwards, really. And in the summer is where we ask you if you're available to offer that project in a particular academic year. So signing up and saying, yes, I've got a project that I'd love to work with a student on doesn't necessarily mean you have to do that straight away or every year. It could be something that you offer when it suits your availability. So I've talked about what we do in Year 2. To try and get the students up to a really good standard with their academic writing so that they're able to take the opportunities offered in SSM2, we have a structured and supported academic writing programme that the students all go through. So they're taught how to search the literature, they're taught how to critically appraise sources, and they're taught how to do academic writing and referencing. So if you signed up as a convener, you wouldn't have to do any of those things. Your role would be to give your specialist knowledge and to share your passion and your enthusiasm for the subject. For me, as SSM director, that's something that I think is very important. It's an opportunity to really get the students involved from an early stage in, something that's a particular interest of yours, and, to enthuse them about your specialty. So SSMs are compulsory. Every student has to do them. They have to be passed, and the focus of the 4 weeks is for them to produce a 3,000-word piece of work that will then be assessed. There are other opportunities as well. So often conveners will offer clinical experience alongside the kind of supervision of the project. So just to go into more detail briefly about this process, what I will say at this point as well is that there is a full training program available online, and I'm always very happy to kind of talk to people about what's involved in the process and what's involved in identifying a good topic for an SSM. So the first step is always to think about what would you like to offer an SSM on, what topics are you interested in, what do you think the student might be interested in. Then we ask that you think about how you might work with the student on that. So most of our SSMs are what we call critical inquiries. They're reviews of the literature. But if you have some data, or if you want to do something that's kind of more case-based, more patient-based, that's also an option. The training program helps you to think about whether or not the topic that you're suggesting is in the right depth for the students, what skills and experience they have at that level. And what we ask you to do is just basically fill in a small outline proposal with your details and an outline of the project that then goes into the catalogue. So, we need to know what the student's going to study and how they're going to do this and how you're going to support them in that process. All the projects, again, go through a quality assurance process. So they are checked by myself as director of the SSM programme. And I work very closely with conveners to try and make sure that they are, putting a project into the catalogue that's going to be well received by the students. So if you've got an idea and you think that there's something that you might like to offer, come and have a chat with me about it, and I can help you to write it up into something that will be suitable for the Year 2 students. I'm going to briefly talk about what is expected within those 4 weeks before I tell you about the kind of time commitment and other stuff. But fundamentally, what we want you to do is support the students through the process. So introduce the topic to them, enthuse them about it, give them a few guidelines, places to start, constructive feedback and criticism during the 4-week process, and meeting with them, we say at least once a week, just to make sure they're progressing okay. So, you know, what you're really committing to is up to 4 meetings and maybe some email or Teams correspondence with the students throughout. We ask that you give them some comments on the assessed piece of work that they are submitting before they submit it, and then we ask that you get involved in our marking process. So it would be your responsibility as a convener to mark the assignment, to find a second marker and to agree that mark. Now again, I think it's important to say that, you know, your role as a convener would not be to give them a lot of support with the writing. We ask that you kind of help them to think about where they could improve, but fundamentally we're looking for you to offer something that is around your specialist topic area, more than we're looking for you to support that aspect of the student work. A lot of the students are really good, and that's fantastic because they can go on to publish from their SSMs if they produce something of adequate quality. And, you know, students they take their SSM projects to conferences, they write them up for academic journals. So there's also that potential benefit for yourselves as well as conveners and potentially co-authors. So I've talked a little bit about the time commitment already. It's roughly maybe an hour or two for this 4-week period in November, December, then the marking, which is December and January. Full online training module is provided, and I'm always happy to take questions about anything that's not clear from that training. Benefits, we pay, or the medical school, not me personally, pays for convener time. And so generally speaking, that goes to an individual if they're not affiliated with one of our local trusts, or it goes to the trust itself, in which case it's kind of up to the undergraduate office what happens with that, but often trusts put it into a separate kind of pot, and it can then be used for training and kind of belongs to you as a convener. And more than anything else, it's a real chance to inspire students at an early stage to get involved in your specialty when it might not be something that they see until much later in their training. Because it's a summative assessment and it's this kind of 4-week block of working with 1 to 4 students, this is suitable for anyone who is ST3 or SAS grade and above. And again, I've put our medical assessment email address on screen if you want to get in touch and ask any further questions about that. I'm going to talk now about our selectives in advanced medical practice, our SAMPs, and these are the year 5 projects. Okay, so I think it's confusing that we call them SSMs and we call them SAMPs, but hopefully I can give you an idea of what the difference between the two is. So SAMPs are a bigger commitment. They are working with our final year, our year 5 students, and if you took on a SAMP, you would have the students with you for 7 weeks. Okay, so again, they select from a catalogue of choices, available SAMPs every year, and it's the idea of them is to give them this opportunity to really go into depth about a specialty and to explore where they might want to work in the future. So if you took on a SAMP convening role, your main task would be to have meetings with the students at the start, the middle and the end of their 7-week placement, but also to make sure that they were getting adequate clinical experience with the team. So it doesn't just have to be you as a supervisor. These can be kind of delivered a little bit more broadly across a different specialty. And we talk about the kind of outcome, the assessment, being a sign-off as, you know, this student from working with them over these 7 weeks, I say that they are ready for day 1 as an FY1 doctor. We have SAMPs across all the different specialties. You know, this year, some examples, we had some in orthopedics, medical oncology, all kinds of things. Now, you can offer 1 SAMP per year, so 1 7-week placement within your team, or if you want to offer more, you can offer a SAMP every rotation. So there are 5 rotations within year 5, and some teams, some clinical conveners, choose to offer a SAMP every rotation. So it's a little bit of a movable feast in that respect. You have opportunities to get involved a little bit more or a little bit less, depending on what your commitment is. I think SAMPs are fantastic, and I'm really glad that we have them at Lancaster, because they do give a bit more opportunity for you as a clinician to work closely with one of our students. And by the time they get to year 5, you know, they're flying, they're fantastic, and it's really great to have the opportunity to, you know, offer them something that they've chosen and they want to get involved with and learn more about. There isn't very much requirement for kind of advanced training. We give you a lot of information about what the placement should look like, what we're looking for in terms of this kind of FY1 sign-off idea. And the benefits really are just to showcase what you do and to try and inspire people to go into that specialty in the future. This is an opportunity for people who are a little bit further on in their career, so more senior clinicians, quite often consultants will lead, but as I've implied, it's something that you can potentially get involved in as a team, I guess. So one person has to lead it, but you know, you want to make sure that everyone is on board with having the opportunity to, I guess, deliver some of that educational process to the students. And I've put a couple of email addresses on the screen. So Dana Bate is our Year 5 coordinator, and our Year 5 lead is Dr. Martin Armour. So either of those can be contacted about this. And if you are interested in getting involved, it's a little bit time specific, because we have to have the SAMP catalogue available for the summer so that the students can choose them in advance of going into year 5 in September. So if you have been inspired by this and you'd love to get involved, get in touch with Martin or Dana as soon as possible if you think it's something you could offer in the next academic year. I'm going to talk now about our OSCE process, and this is going to be quite a brief overview, because I think this is something that people are a little bit more familiar with in terms of getting involved with in medical education, but I'm happy to take questions afterwards if that's not the case. So OSCEs, as you know, are objective structured clinical assessments, and maybe some of you are already involved in this, but there's something that I thought it was really important to mention, because there's something that we are a key part of our assessment process, and we need a lot of people to get involved in them. So if you would like to volunteer, I'm very certain that the team would be glad to hear from you. So in the OSCEs, like the MMIs, we have a circuit of stations that the students rotate around, and each one is designed to try and assess the students' knowledge and clinical skills in a particular situation. So it's these simulated clinical settings with different scenarios, simulated patients, mannequins, and again, you're given full training on how to assess, very detailed criteria about what we're looking for in terms of making sure the students meet the learning outcomes. We have 2 OSCE periods every year. So one is in January, February, which is our formative exam period, and one is in June, July, which is the summative ones. And there's something that I think you're all aware are a vital part of medical education, and ensuring that quality standard for our students. So the time commitment, we talk about kind of up to about 6 days a year. Again, this is a bit of a movable feast. If it's not convenient for you to get involved on a certain day, you don't have to, and it's up to 6 days. You can do 1 or 2 depending on what suits you. Again, there is a full online training programme that you need to complete, which has a short test at the end of it, just to make sure that you've understood the kind of content of the training. And main benefits are that it's something that you can actually use and put on your revalidation and other kind of quality assessments of your own practice. So this is a quite a good way to get involved and sign off some of those different domains. Examiners, anyone who is registered and in good standing is welcome to get involved. From roughly speaking FY2 upwards. So we used to have OSCEs in year 1, 2, 3 and 4. At the moment, because of COVID pressures, we've removed the requirement for an OSCE in year 1, and there was a lot more opportunity to get involved in the year 1 OSCE for younger colleagues, people who are earlier on in their training. But if you think it's something you might want to get involved with, every trust, including your own, has an OSCE coordinator in the undergraduate office. They're a great person to talk to about it to get a bit more information. Or you can email our team here, Med Assessment, and they can give you access to the training programme and let you know a bit more detail if you've got any questions. Okay. So those are the main opportunities that I wanted to go over this afternoon. I'm hoping that there's been something in there that has been of interest to you that you might like to get involved in. I'm hoping that I've outlined some of the, I guess, the requirements, the different ways you might get involved, the time commitment, the skills required, and the reasons really to get involved with the different aspects of our curriculum. Hopefully it's giving you a bit of inspiration to think about where you might want to get involved. And, we're always looking for more people to get involved in the different aspects of the curriculum. I think it's all of what I presented are fantastic opportunities to take on different bits of the process of medical education and to really ensure that we're getting those really good quality, thoughtful, skilled students and supporting them and nurturing them and getting them ready to a point where they are happy to take on independent clinical practice in FY years and then beyond into the specialties. So as I said, and I'm just going to pause on this slide for a moment so that it is recorded and people have access to it in the future. These are just the contact details for the different aspects of the programmes if you want to get involved in each of them. Again, my reminder that if you give us your name and your details and so forth, we will use them to contact you just for GDPR purposes. And thank you very much for your attention this afternoon. I've really enjoyed giving you a bit of an overview and a flavour of the kinds of things you might want to get involved in. And now I'm happy to take any questions if there are any from anyone. I think I'm kind of chairing this little bit. So if anyone has a question, maybe you could raise your hand. I'm happy to take questions in the chat, or if people aren't able to unmute. Or if you want to raise your hand and unmute yourself, that's also something that I'm happy to take.
Hi Liz, it's not a question as such. It was it's more of a thank you actually, because that was really, really helpful to me. All no that I'm sort of new to the role, so knowing all about that was really good. Thank you.
Oh, fantastic! I'm glad it was helpful. And like I say, it's a bit of a whistle-stop tour. But if nothing else, I'm hoping it's given people a few ideas of, what they might do and how they might get involved in different aspects and then who to get in touch with to get more information out of that.
Yeah, perfect. That. Thank you.
Wonderful. It's always tricky when you've given people a lot of information. You're thinking to yourself, I'm hoping that everyone is kind of processing and taking it in. And it might be that there aren't any particular questions at this point, but that people are happy to get involved with and happy to contact any of the people that I've given email addresses for to ask for more information about specific aspects. Great. Well, I mean, if there are no questions, I'm happy to let everyone go about the rest of their day. And thank you again for inviting me, and I hope it's been useful for people. Hoping that if people haven't been able to attend this lunchtime, that, feel free to watch this again. And if there are any kind of other things that people want to raise going forwards after the meeting, I'm happy for them to get in touch with me or to get in touch with any of the addresses that I've provided.
Thank you, Liz. Thanks so much for your time today. We really do appreciate it, and it was really informative. So I'm sure we'll generate a lot of interest. Thank you. Wonderful. All right. Well, thanks. And thank you for inviting me and the continued support that Blackpool have for our educational programmes. Wonderful. Okay. Well, I'll say goodbye to you all then and let you go about the rest of your afternoon. Thank you. Thanks. Bye-bye.